Welcome to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Today, we're going to talk with a physician about a hidden health issue you may or may not know about. It's fatty liver disease. This is one ailment that isn't talked about much, but one you should be aware of since the liver is an essential organ with multiple life-supporting functions. But first, Millennium Physician Group is a leading comprehensive independent physician group in Florida with more than 560 healthcare providers at 150 locations in 19 Florida counties. We service over 500,000 patients. Millennium Physician Group is your connection to a healthier life. Learn more at millenniumphysician.com. Connection, innovation, Inspiration Health. Welcome to Inspiration Health Radio, sponsored by Millennium Physician Group. Each week, we talk about the healthcare issues that are important to you, inviting providers and experts to inspire you to take control of your healthcare decisions. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. Well, according to the Cleveland Clinic, and I quote, fatty liver disease is a common condition caused by the storage of extra fat in the liver. We know the liver is an essential organ, but how does something like fatty liver disease go undetected? Well, that's what we're going to kind of learn about today. Our guest is Dr. Michael Koren. He's the Chief Executive Officer at Jacksonville Center for Clinical Research. And Dr. Koren, I'm so excited that you're here with us today. I really appreciate your time. Give us a little background about yourself, and then we're going to dive right into the liver function.
Sounds great, Michelle. First of all, thank you for having me, and good morning. So I will disclose to start that I'm actually a cardiologist.
Right.
So the first question you might ask is, why is a cardiologist talking about the liver? And I will say, one, is that I'm also an internist, so that's a little closer to the liver. Mm-hmm. But two, there's a very, very important connection between cardiology and liver disease, and that's cholesterol. So just to remind everybody, cholesterol is a fat, and it's an extremely important fat. In fact, every cell in our body makes cholesterol from basic ingredients, from basic chemicals. You don't have to actually ingest cholesterol to make it in your body because it's so important for numerous cellular functions and the structure of cells. So the body has to make cholesterol. The problem is that the body has too much cholesterol, so it has to figure out how to get rid of it. And that's where the liver comes into play. So the liver is responsible for taking the cholesterol that's made by the cells, that's put into the circulation, and then removing it into the intestines. And there's several challenges when that happens. Number one, as I mentioned, cholesterol is a fat, and the blood is liquid. So how do you get a fat and liquid to mix together? That's the whole chemistry experiment.
Right.
So the body's able to do that. And then the body also has to get the cholesterol to a place that will ultimately get the extra fat and cholesterol into the stool. And that's where the liver comes in. And one of the key parts that connects what I've done for the last 30 years and the liver is something called the LDL receptor, low-density lipoprotein receptor. And those receptors are in the liver. And a lot of the drugs that we've developed that are life-saving drugs manipulate that receptor to make it work better. So everybody's heard of statins. Mm-hmm. How do statins work? Statins work by upregulating the LDL receptor in the liver, make the liver work better. Okay, so great, the liver's doing its thing, and one of the questions is, well, what is the liver anyhow? Well,
right.
it's this big blob in the top right part of your abdomen, which is incredibly important. It's your body's chemist. So think of it as the body's pharmacist. So it gets rid of toxins, and you learn about that in high school biology. But again, it also is involved in the metabolism of fat. And as we know, we're in an obesity epidemic. We have rich foods. We have too much to eat as a society. And so our liver is under siege.
Right.
Our liver has to figure out how to get rid of all this extra fat. And so a lot of the research we're doing is focused on this. And unfortunately, we tend to overwhelm our livers with this responsibility, and then extra fat develops in the liver. And then ultimately, that becomes a source of disease and problems for a lot of people.
Yeah, we just had a few weeks ago, we talked with Dr. Albert Lopez Jr. He's a Millennium Physician Group internal medicine doctor.
Terrific guy. And
we did a whole conversation on cholesterol that aired on November 13th. So there's a good reference to go back to for our listeners. And then this goes even deeper into other functions that cholesterol affects. So the liver, more than just fatty foods, we have alcohol that affects the liver as well.
Absolutely. So just to a more general discussion about the liver and what it does and things that can cause liver problems. And again, I'm not a liver specialist, but as a physician, I know some of these things. So the things that you may have heard about mostly are alcohol, which is a huge problem and is a big source of long-term liver problems, including cirrhosis. And the other big one is hepatitis, which is a viral illness that affects the liver, which is a big problem in the U.S. and many other parts of the world. In fact, in Asia, it's a huge problem. So So those are other things that can affect liver function over time that are things that get acquired by living or bad habits. But the number one problem right now for Americans is actually fatty liver disease. And fatty liver disease will start with deposition or accumulation of fat in the liver, and that will trigger this cascade of problems, including inflammation, ultimately fibrosis or scarring, and then ultimately cirrhosis, where the liver is just not working. And when the liver stops working, a lot of bad things happen, and that literally affects multiple functions of the body, including your clotting system is very, very dependent on the liver. Obviously, the way you absorb foods and metabolize vitamins and important things are involved with the liver, and a multitude of other things that is beyond the discussion for today. We could spend. I'm sure you bring a liver expert that can tell you every single detail about what the liver does. But I'm going to get back to the focus on fat and metabolism. So what the liver does basically is it takes all this extra cholesterol, and remember, every cell in the body makes cholesterol, except your eyelashes, by the way. It's the only cell in the body that can't make cholesterol by itself. So
all right,
a little trivia fact. So it takes all that extra cholesterol, brings it into the liver, and then it turns it into a bile acid. So that's a term that you may have heard, and that's what eventually will get into your gallbladder, and then it'll push the bile acid, which is basically used cholesterol, and puts it into the intestines. And it's very interesting. Your body has these very, very complex feedback loops, and the bile acids are part of that. So the bile acids are, interestingly, the way you get cholesterol, but they're also the way the body absorbs fats. So it's kind of this cycle of bile acids getting rid of cholesterol, but also absorbing other fats. So there's been a lot of trying to research and basic science understanding of how this all works and how we can manipulate that. And then you get into some of the products that we're using. But I will say, before we get into any drugs or any discussion about that a very, very important element is good diet and exercise.
Right. Because
ultimately, these are lifestyle diseases. So if we all had a vegetarian diet and exercised every day and didn't overuse alcohol, our livers would be just fine.
Right. That movement factor again, too. How does something like fatty liver disease go undetected for so long?
That's a great question. So our liver is a very robust organ with a lot of extra capacity. Ultimately, if we abuse it enough, we will use up all that capacity. But during the course of one's life, you may be causing some liver problems and not even know about it because of this extra capacity. So and I'm sure we'll get into this into more detail, but we have technologies now that can look at the early stages of liver disease, including the earliest stage is when your liver just has more fat than what it knows what to do with it. So it just stores it in the liver until it can be processed. And unfortunately, if you keep on eating too much fat, if you keep on doing the same things in terms of over abuse of alcohol and just poor diet and lack of exercise, ultimately your liver is going to lose.
Yeah, and I think Dr. Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research, I think a lot of folks can say, oh, if I have problems with my liver, I'm going to turn yellow. Is that the first sign, or what are some of the signs? Sure.
So those tend to be the very, very late stages of liver disease, and that can actually happen when you have an obstruction of the biliary system. So if you basically accumulate bile in your body, that's what turns you yellow, and it's called jaundice. That's the medical word for it. So there could be obstructive issues that are not specifically related to the function of the liver, but more the pipes between the liver and the intestines.
Oh, okay.
One way to think about it.
Right.
The other thing is that ultimately the yellowness is due to the metabolism of hemoglobin. So, for example, if your hemoglobin, your red blood cells are broken down rapidly, you'll turn yellow as well. And you're just basically overwhelming your liver's ability to remove that material. Mm-hmm. And so jaundice in of itself is a sign of end-stage liver disease, but it's not necessarily end-stage liver disease. There could be other things that are just acute that cause jaundice.
Okay. All right. Well, we are going to continue our conversation with Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research. And coming up next, we are going to continue the conversation about fatty liver disease. We're going to get into something called NASH.
Yes.
We're going to talk about that. So you're definitely going to want to stick around. Inspiration Health Radio is sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you, inviting experts and providers to inspire you to take control of your healthcare decisions. Today, we are talking with Dr. Michael Koren. He's the Chief Executive Officer at Jacksonville Center for Clinical Research. And we spent the first part of the show, Doctor, talking about the essential organ that is the liver. Super, super important function of that multiple life-saving organs. So let's continue the conversation about fatty liver disease. And at the end of the segment, we were like, what is NASH? What does NASH stand for?
So NASH is a term that's thrown around, and let's define it for everybody. So it actually is the initials for non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis.
Okay.
And there's also something called NAFLD, which is non-alcoholic fatty liver disease. So these are just fancy ways of saying that you have fatty liver, and which is, as we started to talk about, is the first stage of developing liver problems due to the accumulation of cholesterol and fats in the liver.
Do most people have fatty liver disease?
A lot of Americans do.
Just because of diets and stuff.
Yeah.
It sounds like this is something that most people probably have.
Not most people, but most overweight people do.
Okay.
So let's put it that way. If you're real skinny like you don't have nothing to worry about.
Okay. At least it's not accumulating in my liver.
Well, I don't know you that well, but
right. No worries.
It's probably not fat. It could be other things.
Right, exactly. No worries at all. I totally get it. I was just saying it just because it sounds like it's a buildup that happens in the liver that could really affect more people than we realize.
Right. And as we talked about, there's a staging of liver disease over time. And the first stage is just excess fat. And then if you keep on challenging your liver, then ultimately you're going to get inflammation. And then inflammation leads to scarring. Fibrosis is one of the words that we use, where it gets hard. And then if you do this over and over and over again, you basically use up all your excess capacity in the liver, and then you get to a point of cirrhosis, which is the point of no return. So the way we want to think about it is that we want to give people the concept of fatty liver as early as possible so they can do something about it in the early stages. So it's very, very reversible in the early stages. Once you get to fibrosis and scarring, it's not reversible anymore. And certainly once you get to cirrhosis, then you're looking at liver transplants and these really major ways of intervening to help people. And fatty liver is now the number one reason that people get liver transplants. So that's a big change. It used to be hepatitis.
Wow. That is a big change. All right, so going back to NASH and non-alcoholic, something with an S.
Steatohepatitis.
And hepatitis. Okay.
Steato is just a medical word for fat.
Okay, all right.
We like to put fancy things in so we can charge more.
Right. All right, so how is this treated?
Well, the first stage is diet and exercise. So as mentioned, this is the cholesterol from your body being processed by the liver and some of it getting left over and put into your liver. And so for the focus for the first stage is literally just intensifying diet. But then you get into all the research stuff that we're doing, and we can talk about now, or we can talk about in a future segment, but there's so many different strategies to try to figure that out. And just from a broad sense, one is we want to maybe manipulate the enzymes that are responsible for getting fat out of the circulation, out of the liver, and use medicines that promote that process. The other part of it is appetite. So we're doing studies now that are really studying, like, why are we hungry and why don't we get full quickly? Like, what makes us overeat?
Right.
So there's a whole bunch of science on that. And so if you think about it, well, if we stop overeating, then we won't have so much fat to process and our livers will get better. And that's actually true. So that's another method we're using. Back in the old days, we actually did surgery for this issue. So before we had good drugs, when I started my training years ago, there was actually it was called ileal bypass surgery, where you cut out the part of the bowel that's responsible for reabsorbing fat. And that would lower cholesterol dramatically. It would help the liver. People actually live longer. But we have better ways of doing that now. Yeah.
Okay. It's very interesting because a lot of folks will do the bariatric surgery too.
Right, exactly. And I was about to jump into that point, so thank you for bringing it up. And bariatric surgery is another strategy, not only to lose weight and feel better about yourself, but actually to help your liver. So less absorption of fat, less challenge on your liver, better outcomes.
What about folks who have had their gallbladder removed because of gallstones? Are gallstones made in the liver and then moved into the gallbladder?
Yeah, it's a little bit different. The gallbladder is right next to the liver, but it's a different organ. And the gallbladder in and of itself is just a storage area for bile acids. And it could store bile acids, which is part of the metabolism and the digestion of fats, as mentioned. But gallstones is when there's some sort of dysfunction that occurs where those products harden. And gallstones are common, but if they get to be numerous enough and obstructive of the bile ducts, then bad things happen, including jaundice or needing your gallbladder taken out.
Yeah, that happened to my daughter.
Oh, wow.
Just about a year ago. Young 20s, and had to have her gallbladder removed because the bile duct was obstructed.
Yeah.
And
people can live fine without a gallbladder. It's a storage area for the bile salts.
Okay. We are talking with Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research. What about a fiber scan? This is something we were talking about in the break a little bit.
Yeah. So there are a number of imaging technologies that we use to make the diagnosis of liver disease, and FibroScan is one of them. It's called elastography. And basically, what it's doing is it's sending these waves into the liver. You can think of it as a form of ultrasound. And it sends the waves into the liver to see the density of the liver and make determinations about how much fat or fibrosis or scarring there is based on these density patterns. So the nice part about it is that it's non-invasive, non-toxic, relatively inexpensive technology for people to be diagnosed with liver disease and to stage it. You can also stage liver disease with CAT scans. The downside of CAT scans is it uses radiation. You have MRI scans. They tend to be more expensive. Some people don't like to be in the tunnel. They make a noise and that sort of thing, but they're very effective at doing that. But those are much more expensive technologies. Those require machines that cost millions of dollars. FibroScanner is a machine that costs $100,000. So the technology technically should be more available, but there are some reimbursement and billing issues why a lot of physicians don't use it. So it's not reimbursed in general by insurance, but it's a very simple concept that will allow people to know whether or not they have fatty liver disease and stage it in a very basic level. And one of the beauties of our research group is that we have access to the fiber scanners. So we use fiber scanners for research all the time. They're part of our projects, and we do community outreach events where people can get free fiber scans. So that's one of the things that we provide to the community as part of the Jacksonville Center for Clinical Research and the Encore Research Group.
Right. And let's talk about that. So how do you screen for fatty liver through these fiber scans?
It's simple. It's a simple machine. It's gotten smaller. You can put it on a desktop nowadays. And you take a probe, and somebody who's been trained as a technician will put the probe on the area of the liver and then take these images. And the images will give you a sense for the density of the liver, and that translates into the amount of fat that's been accumulated in the liver. So obviously there's a lot of software and processing and all that sort of thing, but the patient experience is pretty straightforward. It feels like an ultrasound on your liver, pretty much.
Wow, that is cool. And I know you guys do a lot of trials, and we'll talk about that in the upcoming segment. But what else can you tell us about fatty liver disease? Is it ultimately deadly if not treated? Yeah, if it progresses if it progresses, again, it'll go to fibrosis and then ultimately cirrhosis. And then when you have cirrhosis, your liver stops working. And if your liver stops working, you will ultimately die of that. Now, fortunately, there are liver transplants. So there is a bailout, but that is a very, very expensive bailout, and it's not a lot of fun. That's going to change your life. What happens with a patient who is waiting for a liver transplant? I mean, what's like the process of the waiting game? I'm certainly not an expert in that. Right. So I've obviously had patients that have gone through that, but it's a very extensive process that will basically consume your life for a year. And, the waiting game can be difficult. And in the interim, there could be some, very tricky medical situations. So as I mentioned, the clotting system of your body is affected by the liver, and then you may have bleeding problems with cirrhosis. You can get varices that cause bleeding in your esophagus and other places that can be really nasty and cause a lot of problems. It actually affects your mental status. Your liver is responsible for getting rid of toxins that make you crazy. Right. So one of them, you get a buildup of ammonia in your blood, and you can't function like that. So often we have to use drugs just to get rid of the ammonia because the liver's not doing that function. So life without a liver is not a good thing. Right. And can you live with partial liver? Well, again, there's a lot of redundancy to the liver. So it's one of those things, if you have a healthy liver and let's say you had a cancer, God forbid, and you have to cut out, a quarter of the liver, you can still live. So there is a lot of redundancy, but, like any other organ, it has its limits. Right. All right. Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research. We're going to continue the conversation. We're going to talk about some trials that JCCR is conducting about liver and fatty liver disease. So you're definitely going to want to stick around. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you, inviting providers and experts to inspire you to take control of your healthcare decisions. Our guest today, Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research, having a very in-depth conversation about something that's not really well known, very hidden danger called fatty liver disease. And we've learned a lot about the liver and about the functions of the liver and about what happens when those functions start to break down in the liver and why it can cause extreme problems in health down the line. We did speak about some treatments such as diet, movement, not a lot of alcohol. So what are some things that, especially in the clinical field that you're in the trials, what's going on with some new stuff, Doctor?
Sure. So as you mentioned, I'm the Chief Executive Officer of Jacksonville Center for Clinical Research and the Encore Research Group. And we have a great joint venture with the Borland Groover practice, which is the biggest GI practice in the area. And I think
Love them.
Yeah, the biggest in the state. So they've been tremendous partners, and we work very, very closely together on research. So we're running a lot of studies right now in fatty liver disease and in GI illnesses, gastrointestinal illnesses overall. So there are no approved treatments right now for NASH or NAFLD or fatty liver disease, although there's a lot of things on the horizon. And as you mentioned, it's diet and exercise and right. Obvious liver toxins is really what we do, and losing weight. We know right. that you mentioned bariatric surgery, and bariatric surgery will help people lose weight and help their liver. So those are all important things. And then we talked about some of the things that are now specific for changing the metabolism or the chemistry of the liver, and we're doing a lot of really neat stuff in that area. So one of the things, and I could get a little nerdy here, so just hit me if it gets a little bit too technical.
If my eyes start to roll or glaze over.
If you're falling asleep, I know that I need to stop and move on to something else.
I'll be like, wait, Doc, come back to the real terms.
Yeah. Okay. Right. So I'll get a little bit nerdy, and we don't want people to change the channel.
Right. No.
But anyhow, so one example is there's a receptor called the Farnazoid X Receptor. We'll call it FXR.
I can work with that, right?
Okay.
Yeah.
Okay, FXR. And so this is actually one of the key genetic elements of how this metabolism loop works. And so we're doing studies with different sponsors to see if we can turn that gene on, whether or not we can get rid of more fat and get the liver to process cholesterol and fat much more efficiently than it would otherwise. So we're working with different sponsors on that, and that can be targeted in different ways. It can be targeted with a small molecule, which is a pill basically, or it can be targeted with something that is injected that actually stimulates the gene product with RNA. Mm-hmm. RNA has gotten a lot of discussion these days because of the vaccines and how successful it was creating a vaccine. Both the Pfizer and Moderna COVID-19 vaccines are using messenger RNA technology. So with messenger RNA understanding, we're either pushing the synthesis or the ability to make a protein with RNA or blocking it.
Okay.
Okay, so you can think of it in both ways.
Right.
So for the vaccines, we're giving a product that makes a protein that teaches our body that this is the bad guy, and it activates the immune system. But we're also using products, and we do this all the time for cholesterol treatment now. There's actually 2 products in the market that do this, that tell the body, don't make that protein because this protein screws everything up. Mm-hmm. And so both of those approaches are being used when we talk about fatty liver disease. We want to encourage the good proteins and block the bad proteins.
Makes sense. In theory.
Yeah.
So do you use, I'm guessing, and this is going to probably sound like one of those questions, like, are you using real people for these,
Absolutely.
For these trials? Yeah, of course you are.
Yeah. So
where do you find them?
Well, this is the fun of what I do every day. And we have a great group of people, fabulous physicians who are very, very involved in research that reach out to their patient population and educate them about what we do. But we actually run the gamut of research in humans. Clinical research is basically a word that says doing research in humans. And of course, nowadays there's so much done in the test tubes and so much done in lab animals, et cetera. So we know a lot about these products before they ever touch a human being. So we have a pretty good idea of how they're going to work. Mm-hmm. But at the end of the day, we need to see how they work in humans. So what we do is we have phases of research. So in the first phase, we call that phase 1. We do that here in Jacksonville. People come to our center. They stay in a nice room with a big TV screen, and they're able to sit there for 4 or 5 days and get a new medicine. We'll give them 1 dose and make sure they're okay. So we test their blood, we entertain them, we feed them heart-healthy meals.
I was going to say, you've got to feed them the right way.
Yeah, we'll have a Scrabble tournament every once in a while. But basically, they're there because they receive something that's fairly brand new, maybe used in only a dozen people before, and we want to make sure it's okay. But most importantly, get their blood and their urine so that we can see how it affects their body and how their body affects the product. And so that's phase 1 research. And people do that because they're either really, really scientifically interesting interested in the process, or they actually get paid to do it. So it's a nice little check for people that are volunteering, and it's very, very helpful. So that we have that phase 1 research. Then we have phase 2 research where it's gone through phase 1. We know it's basically safe. We know basically how it works, but we still have to figure out the right dose. And that's the key of phase 2 research, is getting the dose right. So we do a lot of phase 2 trials. They tend to be outpatient trials, although sometimes people stay overnight, but they're typically outpatient trials. And again, it's typically people that have the disease that we're treating. Sometimes in phase 2, we're looking for relatively stable patients because it's still relatively early on in the drug development, but people that may have not been helped with the previous treatment and are interested in something new. So that'll be a typical profile for stage 2 patients, and those are trials that run maybe anywhere between 200 and 500 patients around the world. And then the biggest area of research is called phase 3, where we basically know how the product works, we know the basic safety, but we don't know how it looks in a big population. And the Food and Drug Administration, FDA, requires that you do trials nowadays that involve tens of thousands of people. So before we would release anything on the market, we would have to do these type of trials. And this is the easiest way for people to get involved in research. So we have a pretty good idea how these products are going to work. And people come in and they get something they won't be able to get in other places. Be part of a really neat process. It's a lot of fun.
Yeah.
Unfortunately, in medicine, there's so much pressure to get people in and out these days that the research is a nice break from that, where literally, if you sneezed last week, we have to write that down and send it to the FDA.
Right.
So it's like incredibly detailed, and a lot of people like that. It's a very nurturing experience. You get a lot of interaction. We have great staff at their front to work with, and you're a part of the process of making the world better.
Right. We're talking with Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research. And I know we can digress for a second with the COVID research that you guys were doing for the vaccine, that you were seeing a lot of people, thousands and thousands of people to get that product moving faster too.
Yeah, so we dosed about 1,500 volunteers with COVID-19 vaccine before the products were approved. Yeah.
Dr. Alpa Patel, one of our Millennium Physician Group physicians here in Jacksonville, I know was very instrumental in that as well. Well, okay, let's circle back to the fatty liver disease trials that you're doing. And there's one, did you talk about the synthetic siRNA?
Sure, and that's called a small interfering RNA. And as I mentioned, there are RNAs that will encourage the production of proteins and others that block it. So small interfering blocks it. And so there's a drug that we worked on for many years that'll be on the market shortly. Dr. Lopez probably mentioned this, called Inclisrin. Inclisrin is a small interfering RNA that will block a bad hormone or enzyme called PCSK9. And it's something that we'll be able to inject twice a year to control cholesterol. So, this is the so-called cholesterol vaccine. Although I have to be careful about that because YouTube might, you talk about vaccines, you may get shut down by social media. But anyhow.
But a cholesterol vaccine, I mean, that's groundbreaking.
Yeah, it's really, really cool stuff. But so we actually learned about that through the way our body responds to viruses. So just to remind everybody, a virus is something that can't live on its own. It has to live in another cell. So it tries to take over other cells. So when it tries to take over human cells, we have defenses against that. And one of our defenses is called the silencing RNAs. So when they see a bad protein being made, they say, let's put the brakes on here. And they actually are able to block the production of those proteins using RNA technology. So once we started learning about this, we're interfering in very, very strategic places, but also enhancing normal bodily functions. So another example of that, and this is really off track, but I think it's like super cool, is that there's a condition that causes kidney stones in kids called primary oxaluria. Okay, so it's oxalate that gets into the urine. And it's based on a genetic defect that's rare but is devastating for young people. Basically, they'll make kidney stones all their lives and go to dialysis by the time they're teenagers. Oh, goodness. But what people figured out is that if you block a step in the pathway to make oxalate, you can bypass the problem and literally by using this technology for kidney stones, change somebody's life. And that's a drug that recently got approved that we worked on.
That is fascinating. Well, Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research, we have one more segment to go, so I hope you'll stick around. The conversation will continue. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you, inviting providers and experts to inspire you to take control of your healthcare decisions. Today, we are talking with Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research, about a hidden health issue you may or may not know about, fatty liver disease. We've gone really in depth about the liver today, Doc, and we're going to do a little bit of recapping too. But let me ask you this. There's a blood test that shows if you have liver issues. Is that the first place you start with your primary care physician?
Sure. There are general screening blood tests that tell you your liver health. They're obviously very basic, and there are very much more complicated, sophisticated tests. But in a chemistry panel, you'll get something called an AST or an ALT, which we call transaminases, and is a quick way to screen for liver problems. And we could look at bilirubin. We talked about that before, which is the breakdown of red blood cells. And if that becomes elevated, become jaundice, and that's another basic test of liver function that is used. But that's often not sufficient to diagnose fatty liver disease. Now, sometimes if those liver enzymes are elevated over a period of time, a doctor will explore and look more, and that can often lead to the diagnosis of fatty liver disease. But that's not necessary to make that diagnosis. It doesn't have to happen to everybody that has fatty liver disease.
Mm-hmm. And the conversation I had with Dr. Albert Lopez Jr., the Millennium Physician Group, internal medicine doc, we had this great cholesterol conversation. That's what you were talking about a lot in the first segment, was cholesterol. And with the plaque buildup, and I mean, he was saying he had a patient once that blood was like cream. It was so thick. Does that contribute to the fatty liver disease as well?
Well, those are typically genetic problems. His patient probably had something called familial hypercholesterolemia, where the blood gets milky. The truth is that those people have such problems with vascular disease with their blood vessels that they won't have to worry about their liver because they won't make it that far, to be blunt. So that's a little bit of a different situation.
Okay, all right. But cholesterol is a big contributor to the fatty liver
Having
disease.
said that, the solution is in the liver.
Yeah,
so
there you go.
With these things, because it's usually the genetic defect is something that you could potentially treat by getting the right medicine or treatment into the liver. But it's usually vascular in terms of what the complications are of the patient, just to be clear.
Yeah, just to be clear, I appreciate that. So, it seems like every health issue, heart disease, liver disease, begins with nutrition and movement,
sure.
and just being healthy overall. What advice do you give patients to make that change?
Yeah, it's a great question, and I spend probably about half of my clinical time talking about this, and I try to practice what I preach. I'm not perfect, but I just tell people it's all about the schedule. So I'm a pretty busy guy, but there's like at least 4 days a week that I'm going to be at the gym, and nothing's going to stop me. And so my routine is to do it after office hours, and I typically, I go to my gym usually somewhere between 7 and 9 o'clock. I usually harass the people there that want to leave, and I'm like the last guy there, but that's my lifestyle. But everybody has to figure out what they like to do. Some people like to exercise in the morning when they first wake up. Some people love to get out and do biking. Some people like to be in the gym and watch sports or whatever you like to watch on TV, watch podcasts about Millennium Healthcare. That would be a good thing to do while you're exercising. But the key thing is you really want to be focused on the schedule. Because if you just have this aspirational concept, I'm gonna exercise, it doesn't happen. You have to really be very disciplined and say, okay, it's gonna be Mondays, Wednesdays, and both weekend days. And this is when it's going to happen, and no one can bother me. And so that's exercise. And the other thing about exercise, you got to do what you like, because if you don't like doing it, you're not going to do it for a long time.
100% agree with you.
Right. So you have to find what you like, and don't overdo it at first. The biggest mistake people get is, okay, I'm going to do my exercise program, and they decide that they're going to run a half marathon the first day out.
Oh my God, that's my husband right there.
And it's a great concept for about an hour, and then they're recovering for the next month, and that's the end of the exercise program. So start slowly. Don't be embarrassed to just do 10 minutes, but you went there.
Yeah.
And if you do 10 minutes for the first week and shut up 4 times, congratulations.
Yeah, there's a big cardio versus strength training argument too. I mean, I've been in races and runs that a person whose cardiovascular, endurance is much better than mine, but they might be twice my size. I'm like, wow, I'm being passed. That's awesome.
Sure.
But where's the balance?
Well, you need both, of course.
Yeah.
And here's the cardiology perspective coming out.
Right.
It should be at least 2/3 aerobic.
Okay. Good to know.
Yeah, that's a rule of thumb, but it's, depending on what your purpose is.
Yeah. So, all right, the schedule with the exercise, but where does the nutrition part fit in?
And, nutrition is interesting both from the standpoint of food choices and also appetite. So we talked a little bit about it, and this gets back to our research, is that a lot of people are saying that, hey, fundamentally, a lot of these diseases are because we eat too much and we eat the wrong things. And why do we eat the wrong things? Well, there's this interesting feedback loop between the gut and the brain. So ultimately, when we eat, a signal goes up to our brain that tells us that we're full. And if that signal is not working very well, then we're going to overeat. So there's actually a lot of research now. We're working on products, including some of the products that are hitting the market now, that enhance that feedback loop. Mm. And fundamentally, maybe this is all about psychology, is that we need to change our pattern a little bit. We're not, we're no longer in the Neanderthal days where we're always hunting for food and we're always worried about the scarcity of food. We're in a different society where we're overwhelmed with food.
Yeah. Dr. Michael Koren, the Chief Executive Officer at Jacksonville Center for Clinical Research. We talked a lot, and, I think what needs to be, the hidden disease, fatty liver disease, just being kind of a little hidden, just what about a person who thinks they might have this issue?
Sure.
How do they contact you? How do we get them into a trial? How do we get them healthy?
Sure. So we do a lot of outreach in the communities, and obviously people should talk to their physicians, primary physicians. We talked about basic lab tests that are screening. If you're overweight, one of the things you might want to think about are fiber scans. And if they get on our website, which is encoredocs.com, they can get involved in one of the clinics that we're doing where we do free fiber scanning to look for fatty liver changes. And again, you can pick up things that you wouldn't pick up using blood tests or other things using that technology, as we mentioned. So that's exciting. We're running clinical trials in multiple places around Northeast Florida. We're running trials in Fleming Island area, down in St. Augustine, here in South Side, West Side. So pretty much any place in Northeast Florida, we will have a location that's running something that's looking at fatty liver changes. And as I mentioned, there's a lot of different technologies that are being used. But the first question is, have a conversation with your physician. But if you're overweight, if you have a history of liver disease, if maybe in the past you overdid it with alcohol and you're worried about it, you can look us up on encoredocs.com, and maybe we'll be able to get you in and take a look at your liver. Mm-hmm.
And you guys do cholesterol checks as well?
We do, yes.
What does that involve?
We can either do it as a blood stick in the arm or just a little finger stick, depending on which type of outreach we're doing that particular day.
Yeah. All right. So encoredocs.com, but of course, definitely see your primary care physician as well, because it could start there with your blood panels.
Yeah, and your primary physician would probably have a lot of insight into your risk. Obviously, some people may be just the worried well and just need some reassurance. Other people might have some significant risk factors that they would like to ignore. So, a typical person that maybe have borderline diabetes, that's overweight, that doesn't love to go to doctors, doesn't love to take pills, maybe that person should be screened for fatty liver disease.
All right. Well, thank you, Dr. Koren, for joining us today. I really appreciate your insight and your expertise with fatty liver disease and how it relates to cholesterol and cardiovascular disease as well.
My pleasure. It was a lot of fun.
Yeah.
Thanks for having me.
I appreciate you. The conversation will continue next time on Inspiration Health Radio. Your healthcare journey, very important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you. That starts with seeing your primary care provider. See our website for a full list of offices and providers at millenniumphysician.com. In good health, I'm Michelle McCormick. Have a great day.